Mari McInerney from Cokie, and we're here at Safer Care Victoria's conference here in Melbourne, and we've just had the first session and we're doing a bit of a vox pop to see what people thought. Would you kindly introduce yourself and where you're from?
I'm Rebecca Prosser. I'm a nurse manager at Alfred Health in rehabilitation, and what I really took away from the session was compassion and care for healthcare workers, which is so relevant and important for my team at the moment and myself really. So thinking about all of those opportunities we've got to look after each other, which will impact the care of our patients.
What are the big issues for your team?
I think there's a level of stress and a big workload. So we really are trying to look after each other at the moment, so we'll take away some good messages from this conference.
Great, thank you very much. Now we're just moving on.
Hi, I'm Olga. I'm from Caulfield Hospital. I'm an access manager, and my takeaway message from this morning was how to recognize and watch out for the signs of stress and burnout within our teams, and how can we look at what we actually do really well and learn from that, rather than learn from looking at our mistakes, but at the same time learn from the areas especially, or the teams that do exceptionally well.
And do you think that gets overlooked a lot?
For sure. We concentrate a lot on what is being what was wrong, or the mistakes that we make, or the harm that we cause, but we don't usually have time. Because of that, we sometimes don't have time to look at positive things, at things that we're actually doing well and benchmarking well within the health services as well.
Fantastic, Olga. Thank you very much. Just moving around the table.
Hi.
Hi.
I'm Justin. I'm a manager at Alfred Health. I suppose the key thing that stood out for me was you can't give what you don't have. And I suppose that resonates with me because I'm a nurse, and I've been in situations, and I've watched people in situations where you get fatigued by, called compassion fatigue really. And if you're not looking after yourself, you're going to be no good to anyone else. And I think it's really important for us to remember that as individuals in the health industry, and when we're trying to give as much as we can to our patients, we need to hold on to a little bit more for ourselves.
And where do you think that lacks the focus in that, there are the crazy stocks days, there's a lot of headlines around burnout. Do you think it's the system is not yet paying attention yet, or workplaces?
Look, I think it's better than when I was training. When I was a young nurse, it was sort of like, come on, just get on with it. We're all working hard and we're all doing our best. But I think now we're having conversations around well-being. How can we look after our staff better? What is it the staff need to give the best every day? And I think it's also really important that we've got leadership support and executive support to be able to allow that as well in our workplaces.
Fantastic. Thank you very much.
No worries.
Hi, so I'm Reid. I'm a director at Rehab, Aged and Community Care at the Alfred, and get to work with these amazing people on a day-to-day basis. And I guess for me, what I took out from that is that culture eats strategy for breakfast. And if we don't have the right culture, no strategy will stick. It's really around how do we support people. So we spoke a little bit about fitting your own oxygen mask first, and about people need to have something before they can give it. And I guess for us it's around how do we make sure that people are overflowing with care internally so that they can really give the best. And that is really, albeit a great culture, but exceptionally strategic. So I think we need to really be focusing more on our staff.
Any thoughts on what those things can be? What's worked for you?
Now that's actually quite interesting, because I actually think I'm very privileged to be in a leadership role, but the team need to tell me what those things are. And we're actually in a process at the moment of going around and asking people what do we start, stop and keep doing at work. Because I actually think the priorities need to be set by the staff. I would be very naive and arrogant to actually feel that I have the answers. What my role to do is to give people the platform and to take all those barriers down. So yeah, lots and lots of good thought there. I've got my Make It Happen book, so I'm just writing down notes. Make It Happen book.
What is that?
It's my little journal, and so for me it's really around actually capturing some of these ideas and making sure that we actually do make it happen.
Fantastic, thank you very much.
Hello, my name's Dina Watterson. I'm a Deputy Director at Rehab, Aged Care and Community Care at Alfred Health. My take home is it's what we do, or the end outcome is one thing, but how we go about it and who we involve along the way is key. And echoing what Mel said, it does need to be ground up. We do need to listen to not only what the value is to our patients and clients, but also what the value is of our staff. And I think doing that and having the combination of our frontline staff and clinicians, our middle managers, and not just the top down from the senior management group is very important. But also understanding, I really love seeing Sarah again. She was obviously someone who was with us at Alfred Health.
Oh, that was Sarah Hawthorne.
That's right,
who was
yes.
the first keynote speaker.
Yes, that's right.
She gave birth while in a coma, suffering from the flu.
That's
right. She recovered.
She's recovered fantastically well. It's great to see. But taking from her is what was really a value to her. So laughing, having the time to laugh with in her physio sessions was at that point in time more important than actually doing the doing. So, and
one sheet, one wipe is not great advice.
Absolutely, and how we greet and how every step of the patient's journey is unique and of value to them, and we need to understand it and hear that along the way.
Fantastic. Can I just jump on the fact that you're working in aged care?
Yes.
There's a big spotlight, of course, on that
Absolutely.
at the moment. What does that mean to you? What are you watching for?
So every day we're definitely very active in our health network around the ageing process and how we support our ageing Victorians and the community. Look, we're really working hard in ensuring that when people are in hospital, that we keep them as healthy as possible and really try and reduce deconditioning while they're with us, but also helping with that transition out of hospital and also understanding what they want to do and helping them fulfil their goals and choices at all stages of their life. And I think there's some big things happening that will change the way we do things in the near future, but that's exciting, and we're all going to be there one day, so we all should invest anytime we can.
Fantastic. Thank you very much for your time.